Well, it is getting harder and harder to find children's Tylenol and children's Motrin. That's because the flu, the COVID, and the RSV, it's causing an increased demand for those medications. WENY's Marcia Augustin spoke to a local doctor about what alternatives parents can do to help keep their child feel better if they get sick. Marcia?
That's right, Nick. It's been tough to find these over-the-counter fever and pain-reducing medication for ill kids. I spoke to an infectious disease specialist about some alternative remedies parents can find at home that can treat their child's fever. New York State Department of Health reports this week nearly 100,000 cases of flu have been reported in kids ages 5 to 17. Everyone is getting sick at the same time, and everyone needs medicine at the same time. This is prompting high demand and scarce supply of acetaminophen and ibuprofen, infectious disease specialist Dr. Justin Nistico says.
When more and more people are in need of that medication, it's like an item you were to buy at a store. If everybody wants that item or it's a hot item, it's going to fly off the store shelves very quickly.
And this is where a lot of parents are stuck and wondering what can they do to help their child feel better. First, he says, speak to your child's pediatrician about your child's needs. There are also home remedies you can use to treat your child's fever.
Like a lukewarm bath, or even using cold compresses on the forehead. Right now, the best approach is trying to, use your resources, call, even looking online. Sometimes they have medications that can be sold, like Tylenol.
And Dr. Nistico explains the threshold for a fever to run its course and a higher fever that might require more care.
A fever is defined as having a number of 100.4. Lower grade temps of like 101, 102, you could say that you're in a zone where you'd be considered it's kind of acceptable. But if it starts to creep above that 102 mark, you should try your best to do things to try to reduce the fever.
And Dr. Nistico added, be sure to read the medication packaging label and choose the right one for your child's age and weight. Lastly, he says, if your child hasn't received the flu shot, it's a good time to consider it, Nick.